On the Health Beat this morning, KOAT's medical expert Dr. Ramo is talking about mini strokes. So he says these need to be taken seriously because they may start small but can turn into something deadly.
The American Heart Association put a whole different picture on these situations. A mini stroke is when you have the signs of a stroke and it clears. But they say you shouldn't call it a mini stroke, and there's a very good reason. What they've found is that about 10% of the people within 48 hours after having these symptoms of a mini stroke have a full-blown stroke. So they want to call this a stroke emergency, and I think that's the appropriate thing to do. That means an immediate action. If you have the symptoms of a stroke, it's really important to get seen.
So here are the 4 things to check to know if you're having one of these mini strokes.
Look in the mirror, and you check right and left eye. You raise both arms to make sure that you're intact in terms of your motor function. You smile, which talks about the cranial nerves, and then you say, KOAT Action 7 News. And if you can do all those things, you're likely not having one of these stroke emergencies. But if you're having them, you need to get to the emergency room, and within 48 hours, you should have an MRI, and ideally 24 hours, because something can be done to stop a full-blown stroke.
Yeah, according to the CDC, every 40 seconds, somebody in the United States has a stroke, and every 3.5 minutes, someone dies from a stroke.